Hi friends, welcome back to All on Law. This YouTube is in this YouTube channel you have USMLE material and MRCPCH and AMC Australian Medical Council examinations and Canadian examinations. So you will definitely will find this channel very helpful, and please tell your friends to subscribe, and please you to subscribe to our channel. If you subscribe, YouTube will notify you that whenever we upload a new video, and you can watch the video, and if you have any updates, if any information, definitely you can tell us through the comments so that it can help me, you and your friends. So just subscribe and subscribe. Okay, let me start with this is a phenobarbital. Phenobarbital is a barbiturate and the most widely used anticonvulsant worldwide, and the oldest still commonly used. It also has a sedative and hypnotic properties, but as with the other barbiturates, it has been superseded by the benzodiazepines for these indications. So these are the indications for phenobarbital or a phenobarbital. What you call the uses is one of the cheapest and the least toxic antiepileptics. Okay, so it's used in a generalized tonic, clonic, simple partial, complex partial seizures. Okay, so it can be used for a status epilepticus. So let me start with this mechanism of action. How does it act? The GABA, A receptor, that is the A receptors, are primary target of the barbiturates in the central nervous system. So it acts on A receptors of a GABA. As is the case for other clinically important barbiturates, phenobarbital prolongs and potentiates the action of GABA on GABA A receptors, and at higher concentration directly activates the receptors. In contrast to anesthetic barbiturates such as phenobarbital is minimally sedative at effective anticonvulsant doses. Okay, let me move on to this. Possible explanations for the reduced sedative effect of phenobarbital includes more regionally restricted action, partial agonist activity, reduced propensity to directly activate GABA A receptors, and reduced activity at other ion channel targets, including voltage gated calcium channels. Although the precise sites where the barbiturates interacts with the GABA A receptors has not been defined, the second and the third transmembrane domains of the beta subunit appears to be critical. Binding may involve a pocket formed by beta subunit methionine 286 as well as alpha subunit methionine 236. In addition to the effects of a GABA A receptors, barbiturates block AMPA receptors, and they inhibit glutamate release through an effect on P by Q type high voltage activated calcium channels. The combination of these various actions likely accounts for their diverse clinical activities. Because this drug acts through the different mechanism, that's why it can be used, and it acts and is helpful in a different kind of seizures. That's the beauty of this drug. Phenobarbital is indicated in the treatment of all types of seizures except absence seizures. So remember, it is no less effective at seizures control than more modern drugs such as phenytoin and carbamazepine. Recently I uploaded a video on a phenytoin, just go ahead with that. It is however significantly less well tolerated. The first line of a drug treatment of status epilepticus are fast-acting benzodiazepines such as diazepam or lorazepam. If these fail, then phenytoin may be used, with the phenobarbital being an alternative in US and used only third line in the UK. Failing that, the only treatment is anesthesia in intensive care. So you should know how to manage the patients with the seizures. That's very important. There are several steps. Definitely I will upload a video on that. How do you take a step? That's very important. Phenobarbital is the first line choice of for the treatment of neonatal seizures. Concerns that neonatal seizures in themselves could be harmful make most physicians treat them aggressively. No reliable evidence though supports this approach. Phenobarbital is sometimes indicated for alcohol and benzodiazepine detoxification for its sedative and anticonvulsant properties. The benzodiazepines, chlordiazepoxide, and oxazepam have largely replaced the phenobarbital for detoxification. Phenobarbital properties can effectively reduce the tremors and the seizures associated with the abrupt withdrawal from the benzodiazepines. Phenobarbital is a cytochrome P450 inducer and is used to reduce the toxicity of some drugs. Look at this. Phenobarbital is occasionally prescribed in a low doses to aid in the coagulation of the bilirubin in patients suffering from Crigler-Najjar syndrome type 2. That is, phenobarbital is can also be used to relieve cyclic vomiting syndrome symptoms. So look at these uses. What I'm going to talk about, this is very important. In an infant suspected of neonatal biliary atresia, phenobarbital is used in the preparation for a 99 mtc IDA hepatobiliary study that differentiates atresia from hepatitis or chondrostasis. So remember the use. This is very peculiar use of this. Okay, now let me jump on to the adverse effects. Sedation and hypnosis are the principal side effects of this drug. Occasionally, there are also intended effects. Central nervous system effects such as dizziness, nystagmus, ataxia are also common. In elderly patients, it may cause excitement and confusion, while in children, it may result in paradoxical hyperactivity. So just remember about the side effect in adult and the children, and it may result in the okay. Another very rare side effects is amylogenesis imperfecta. Okay, now the contraindications: acute intermittent porphyria, oversensitivity for barbiturates, prior dependence on barbiturates, severe respiratory insufficiency, and hyperkinesia in children are contraindication for phenobarbital use. Okay, guys, this just now I talked about phenobarbital. This is very important topic for USMLE Step 1 Pharmacology.